So today we are going to learn about the chakras. Now, we have 11 major chakras, and all these chakras they control our organs and our glands. Every organ has a minor chakra, and along with that we have 11 major chakras and other minor chakras also. Now, these chakras are basically pump house of our energy body. Now, as I had said before, we take in prana from the ground, we take in prana from the air, and we take in prana from the sunlight. So, after taking in all the prana, these are the chakras, they help to basically break down the prana and distribute it in the entire body. So we will understand one by one all the chakras, and I want you all to take notes because these are very important. You need to understand and learn about the chakras properly, okay, to go further. Now, these chakras, as you can see in the picture, they are funnel shaped, right? So, what happens is it is coming out like this, okay, from our physical body. Now, these chakras, they are not located on the physical body. They are located in the energy body. Okay. So it is all in our energy body and it is not like it is coming out from here. If this is our aura, if suppose this is my aura over here. So my chakra is also here like this. Okay. Like a funnel shaped thing which is coming out. Okay. So now we are going to start all the chakras. So we will start from the basic chakra. So our basic chakra, it as you can see in the picture, it is located at the coccyx region, okay, or the sacral region, okay. So you can touch, you can also like feel your basic chakra. You can touch on your coccyx region, okay. So that area is your basic chakra and the chakra is coming out like this. It is funnel shaped. Now what happens is our basic chakra, it has 4 petals, okay. So all the chakras have petals. Our basic chakra has 4 petals and it has also red and orange pranas. Now it also contains a very minute amount of yellow prana. Now, our basic chakra, it controls our musculoskeletal system. Okay. Along with that, it also controls our spine, the quality of blood which is produced in our body. It affects the growth rate of the cells. It affects the growth rate of children. Okay. And it also affects the heart and the other sex organs. Now, our heart is a muscular body, right? So, and since the basic chakra, it affects the muscles, musculoskeletal system, our heart is also affected by the basic chakra. Now, if the basic chakra is malfunctioning, then what are the diseases that can arise? Number one is it can cause arthritis, it can cause spine issues, it can cause slow healing of wounds and broken bones. Okay, then overall it can cause low vitality and any sexual ailments. Okay, so now in a person, uh, now the part of energy which is present in the basic chakra, it also goes to the navel chakra. Okay, so and also a part of the basic chakra also goes to the brain. So if the basic chakra is depleted, the brain might also get affected. Okay, now the elderly people, they have depleted pranic energy in the basic chakra, and because of that they tend to have the healing is generally delayed. Okay, they have a slow healing process, and then the spine also curves, so that they kind of have the curved curvature, and then they bend down. So it is because of the basic chakra is depleted. Okay, and also the basic chakra is actually the center of self survival. Okay, the flight fight, what we say, that is the center of survival. A person who has very a good basic chakra, an active basic chakra, Okay, they are very dynamic individuals. And if a person has overactivated basic chakra, then they become very hyperactive, restless. Okay, they don't get sleep properly. Okay, and a person who has underactive basic chakra, they become very sluggish. They might get depressed, they become sluggish, and they are kind of out of touch with the reality. So, a person who has suicidal tendencies have depleted basic chakra. Okay, so our basic chakra and the soul minor chakras, they take in the ground prana. Okay, they absorb the ground prana, and then after that they send it to the entire body. So the basic and the soul chakras are the main ones which is taking in all the ground prana. Okay, next we move on to the sex chakra, also called as the sacral chakra or the Swadhisthana. So this is the sacral chakra, okay, as you can see in the picture. Now it is present exactly on the pubic bone, okay. Now the sacral chakra, it has 6 petals, okay, and it contains red and orange pranas. Now as the name states, sex or sacral chakra, it affects the sex organs, okay. So it helps and energizes the sex organs, bladder, urethra, okay. Also it partly energizes the legs also, okay. So 30% of the prana from the sex chakra goes to our legs, okay. So if anybody has any leg issues, the sex chakra might be depleted or congested. Also, the sex chakra is linked to our throat chakra, ajna chakra, and also our back head chakra. Okay. Now, so suppose a person has some issues in the bladder. Okay. So the sex chakra might be depleted, and if you see, the throat chakra might also be depleted because both sex and the throat chakra, they are interconnected. Okay. Same, the problem might be some other issues is happening, and you might just cleanse the sex chakra, but then if you scan and see that the problem was in the ajna chakra, so if you do cleansing of the ajna chakra, then the patient might recover. Okay, and also the sex chakra is also associated with the basic chakra. So remember, sex chakra is associated with the basic chakra, throat chakra, ajna chakra, and the back head chakra. Okay, so if any of the other chakras are affected, then the sex chakra might also get affected. So malfunctioning of the sex chakras can cause urinary problems, it can cause sterility, impotency, it can cause issues in the prostate gland, okay, and other sexual ailments. Now, another thing which you need to remember is that it is the center of physical creativity. Okay, it is the center of pleasure, okay, and luxury, right? So, if the throat chakra and the sex chakra, this part of the pranic energy can be sent to the throat chakra. Okay, so this causes, it basically the sex chakra energy from the sex chakra is being transmuted to the throat chakra and the ajna chakra. Okay, now in case of mentally retarded patients, mentally retarded people, the sex chakra is depleted, so you have to constantly cleanse and energize those people very slowly, like over a period of 1 or 2 years, and then, like, there might be some improvement because they have very depleted sex chakras. Okay, and also in the elderly people, in the old people, along with the basic chakra, the sex chakra is also depleted. Okay, so that's why you see that the older people, they become very senile. Okay, they kind of become very senile, and they kind of have not very interested in life anymore. So these are all because of depleted basic and sex chakra. Okay, now we will move on to our Mingme chakra. Okay, so this is our Mingme chakra, and it is located at the back, which is exactly opposite to our navel. Okay, in the front we have the navel chakra, just behind it on the back region is the Mingme chakra. Okay, now this Mingme chakra, it has 8 petals. and it contains predominantly orange prana and also a little bit of red prana. Now it is called as the pumping station. Okay, so pumping station of the energy. Now this, the as I told you, the basic chakra and the soul minor soul chakras is taking all the ground prana. Okay, and after that it is going into the mingme chakra, and mingme chakra is sending it to the other chakras. Okay, now the mingme chakra, mainly as it is located at the back, okay, just behind the navel chakra. So at the back, we have the kidneys. So it mainly controls and energizes the kidneys, the adrenal glands, okay, and also to a certain extent to the other internal organs, okay. And it is one of the most important chakras which regulates the blood pressure. Now, malfunctioning of the Mingme chakra causes kidney problems. It causes low vitality. Then it causes blood pressure issues, that is hypertension, or it can cause hypertension, and also it can cause back issues. Okay. Now, the Mingme chakra is normally one third to half of the other major chakras. Okay, our reference chakra is the back heart chakra. So our Mingme chakra is always one third to half, normally one third to half of the other major chakras. Okay, so if our blood pressure is normal, our Mingme chakra is going to be normal, that is one third to half of the other major chakras. If it is overactivated, then the blood pressure, there might be hypertension. If it is underactivated, there might be hypotension. Okay, and the Mingme chakra is also closely related to the spleen chakra. Okay, now if the spleen chakra is activated, the Mingme chakra is also partially activated. So this is why we should never energize the Mingme chakra. Okay, I will tell about it later on also. You should never energize the Mingme chakra and also the spleen chakras. These two chakras should not be energized. And especially in a patient with hypertension, you should never energize the Mingme chakra. Okay, now the malfunctioning of the solar plexus chakras, Mingme chakra, and basic chakras together will also malfunction the ajna and heart chakra, and it might manifest as an abnormal growth rate of cells. So, in some way, all the chakras in our body are connected, right? So, so few chakras, like if a certain problem is in the navel chakra, we should also cleanse the solar plexus chakra, which is up, and also cleanse the sex chakra and the basic chakra, which is down. So one chakra up and one chakra down should also be cleansed, so that because all of them are connected. So if there is some depletion or congestion in a particular chakra, the other chakra might also be congested or depleted, right? Now we move on to the navel chakra. Okay, so the navel chakra, as the name states, and you can see it in the picture, okay, it is located at the area of your navel. Okay, and it has 8 petals, and it contains yellow, green, blue, red, and violet pranas. Okay, it contains something called as the synthetic key. Okay, it is some kind of energy, okay, which helps circulation of the prana within the meridians. Now, a person having more, the person has synthetic key, more prana the person is going to take in. Now, the navel chakra, it controls the small intestine, the large intestine, the appendix, okay, and also affects the speed of giving birth in women and affects the overall general vitality. Now, malfunctioning of this chakra can cause constipation, can cause diarrhea, okay, and inability to digest food, nutrients, okay, it can cause appendicitis, issues in the intestine, like, the like irritable bowel syndrome, inflammatory bowel disease, okay, and also low vitality. So if you concentrate on your navel chakra, like, if you're just concentrating of your navel chakra and meditating on your navel chakra, it automatically gets energized. Okay, so you just, like, you do those breathing exercises, the abdominal breathing exercises, or you're just, like, meditating on your navel chakra, then it automatically gets energized. Now we move to the spleen chakra. Okay. Now the spleen chakra is located on the left side, okay, and exactly where the spleen organ is. So we have two spleen chakras, the front and the back, okay. And the spleen chakra, it is located at the middle part of the left bottom rib, okay. Now both, they have the same functions, and it has six petals. The spleen chakra, it has six petals, and it is the mainly the entry point of the air prana. Now I said the basic chakra and the soul chakras, they are entry point of the ground prana. The spleen chakra is the entry point of the air prana. Okay, so the spleen chakra is basically absorbing the white prana, and it is breaking down into different color pranas. Different color pranas like the red, orange, yellow, blue, green, violet. Okay, so these are the different color pranas. The spleen prana, it breaks down the white prana, and then it sends these color pranas into the various chakras. So it basically, it energizes the entire bioplasmic body and the physical body. Okay, and it is also means that the major organs, all the major organs and the vital organs, they are affected by the spleen chakra. So for a pranic healer also, since we'll be doing so many healings, we might also attract disease energy. So for a pranic healer, you should always cleanse the spleen chakra at least once in 2 weeks. Okay, and for every healing you do, for anybody's healing, you should always cleanse the spleen chakras. Okay, because cleaning, if a person has severe infections, the spleen chakra will definitely be affected. So the spleen chakra, it controls and energizes the spleen. It affects the energy level and also affects the general vitality. It affects the quality of the blood and affects the immune system. So we know that the spleen, it has red pulp, white pulp, okay, it has lymphoid tissue. So we know that it is going to affect our immunity, okay. So because all the like the all the immune cells are also present there, so it is going to affect the overall immunity. Now, if the spleen chakra is malfunctioning, then the person might have issues in the spleen. There might be overall issues in the immunity, okay, lower immunity level. Also, other blood issues might be there because, as you know, the spleen is the graveyard of RBC. So, all the wasted RBC is being disintegrated in the spleen. So, if any issue is there in the spleen chakra, that might lead to blood related issues. Okay, and also it has been seen that patients with rheumatoid arthritis have depleted spleen chakra. Now, the spleen chakra is closely related to the navel chakra. Okay, so the navel chakra, when it is very highly energized, the spleen chakra is also activated. Okay, now as I told you before, if a person can just concentrate on the navel chakra, okay, the navel chakra is getting energized, okay, and this energy can go to the spleen chakra. But you have to be mindful if the person has hypertension, okay, or affected Mingme chakra, then you should not meditate on the navel chakra. That might lead to worsening of the hypertensive symptoms, right? So these are all the lower chakras. So we have the root chakra, which is located on on the area of the coccyx. Then we have the sacral chakra or the sex chakra, which is located on the pubic bone. Then we have our navel chakra, which is at the level of the navel. Then we have the Meenmay chakra, which is just exactly opposite to the navel chakra, that is the on your back. Then we have the spleen chakra, where we have front and back spleen chakra, which is located exactly at the region of the spleen. Okay, so these are all the lower chakras, and next we are going to learn about the higher chakras, that will be starting from the solar plexus chakra to the crown chakra. So I'm going to see you in the next video.